This story, doctors say the internet could be fueling a rise in self-diagnosis anxieties. Now, patients often Google symptoms in the hope of finding reassurance about their medical fears. This, however, often leads to self-diagnosing further ailments. Well, to tell us more about this, we're joined by Dr. Pete Vincent from Tokai Medical. Dr. Vincent, a very good morning to you, and thanks for your time this morning. So tell us what we're doing. I mean, let's talk about South Africans and this thing called Cyberchondria. Are we more and more turning to Google to find out what's wrong with us?
I think everyone is turning to Google. It's such a wonderful sort of asset to have that you can just Google and, sorry, just trying to get it in the right picture there. That you can just Google anything you want, but more and more patients do go to Dr. Google before they come to see you, and it does cause of sort of anxiety in the patients. So basically, they describe cyberphobia as patients who go online and then they spend more time online searching all their symptoms and trying to diagnose, and they've got the opportunity to go into sort of symptoms of rare disease and then get that sort of belief that they've actually got the disease. So it causes a tremendous amount of anxiety. Interesting sort of fact came out in research in last year from London, in that the NHS reckon that 1 in 5 of their consultations are internet-induced anxiety. Causing a tremendous, they reckon it's caused about £420 million in consults, and then you add that sort of wasted investigations and scans just to get over that sort of anxiety. So it is quite a sort of problem.
A phenomenon, I would say, is what it's become, Dr. Vincent. But I just want to, can I ask you, I mean, how often are they actually getting it wrong? You say 1 in 5. So the other times that we have patients who are looking up, I've got this rash or this seems to be wrong, how wrong are they getting it? Is it necessarily, an absolute no-no to go in and check maybe what could be wrong?
I think they always get it wrong, but I mean, you can get an anal itch, can become sort of bowel cancer. That's the one thing, and then sort of just drowsiness can suddenly become chronic fatigue syndrome. So it does make things tricky from that point of view, and you've got a headache that can suddenly become a brain tumor depending on what site you're sort of going into. So the big thing is to know what sort of sites you're actually going into, and the public should be educated into going into sites where you can get sort of information on how to integrate sort of sites and to sort of try and work out what sites are actually worthy, and usually the sites which are controlled by governments and institutions are far better than the sort of bloggers and all the rest that you get inundated with.
Well, I suppose at the end of the day, however they've diagnosed or whatever it is they think they have, they still have to get to a doctor. They still have to get somewhere for treatment for what they think they have. So what would be the credible places to check? I mean, it's the middle of the night, you're not feeling so great. You want to have an idea, should I go to work? Should I go to the doctor in the morning? Where would you sort of say, this is the place to maybe check what could be wrong so you know that you should get help immediately?
I think sort of sites like the sort of Mayo Clinic, there's lots of England sites are sort of very good. But I think one must just educate yourself on how to sort of find out exactly, what information you're looking for, rather than just going into a site willy-nilly. And I think you should also restrict yourself. If you're spending longer than 20 minutes sorting out your symptoms and trying to research your symptoms, then it's time for you to take action and just make an appointment and go and see your doctor.
Do you often find, though, that those who have researched or self-diagnosed using Dr. Google, when they come to you or other doctors, that it's very difficult to actually explain to them what's really going on, and that what they think is going on is not what's going on? Is that a bit of a battle?
I personally don't mind my patients who are researching before they come to see me. It does sort of sometimes improve communication, but sometimes the patients tend to exaggerate their symptoms to fit their perceived diagnosis, so that can make things sort of tricky and get you on the sort of wrong line of making a correct diagnosis from a professional point of view.
Okay, so
it's far better, I think, for the patient, if he doesn't agree with what the doctor says, go for a second opinion rather than go straight to Dr. Google.
Yeah, I suppose I mean, it's good for a second opinion, but go to a real person, a living, breathing person you can see. Thank you very much for that.
And just one passing note, sort of yesterday when I was doing my house calls, Cape Talk has a thing about, yesterday was International Cancer Day.
Yes.
And a woman phoned in having survived breast cancer. And her first word of advice was, do not go to Dr. Google if you want to remain positive.
Okay, fantastic, because yes, it probably will make you feel sicker than what you actually are. Thank you very much. That's Dr. Pete Vincent just warning us about using Dr. Google, because it really isn't the best. Like he says, go to a living, breathing person who you'll be able to talk to and who can actually really help you. Do you ever use